Good morning, EVS Owls, and happy Wednesday. By now, you all will have gotten a couple of letters from our central office explaining that we have had a couple cases of COVID-19 at the Enfield Village School over the course of the last week. Unfortunately, that is correct. We have now had, over the course of the entire year, 3 cases of COVID-19 in the building, and yes, 2 of them have been in just a week's time. My inbox and my voicemail indicate that people are wanting a little more information, and I don't blame you for that. There are limits to what I can share, but I do have a little more information that I will share with you here and now. The first of these 2 most recent cases of COVID-19 in the building was on Wednesday, March 24th. So that was Wednesday of last week. And the second was this past Friday. That's March 26th. Now, understand that there is a lapse in time between when people are in the building with symptoms or without symptoms with COVID-19 and the time we get that information. It takes time to schedule that test. It takes time to get those results. That information is then relayed to the school, and parents have been very good about communicating that with us. And then it takes us a few hours to do our contact tracing and notify those who have been in close contact. So yes, the cases were last Wednesday and last Friday. Now, I can share with you that those 2 cases are completely unrelated. There is no way that there was any kind of community spread from the first case to the second. No common space or bus or time of the day. The reality is that cases are creeping up in the Upper Valley. We have a neighboring school district that sends a letter home just about every day articulating that there is a new case of COVID-19 in that particular district. So it's out there, and it is kind of creeping closer. I don't think it's something to be overly concerned about. Again, I think that our measures that we have in place will help us to prevent community spread within the building, but there is nothing that we can do to keep COVID-19 from coming into the building that really is beyond our control as the staff and faculty of the Enfield Village School. That's really within your control. The choices that we're making outside of school do have an impact. If we are going to public places that are indoors, like trampoline parks and water parks, we are putting our families at risk, and we're putting our community at risk. If we are socializing indoors without masks, or with masks for that matter, with people that we do not live with, we are putting our families and our community at risk. With the vaccine rolling out, and I'll share that we had a vaccine drive in the district, and all of our staff and faculty and substitutes and bus drivers that wanted their first of 2 shots received that shot this past weekend, and will receive their second shot in just a couple of weeks. So we're getting there, and we know that those shots should become available to all adults over the age of 18 in the next 6 to 8 weeks here. So we're coming to, there's a light at the end of this tunnel, but we are by no stretch of the imagination out of the woods yet. And I think it's important that we take pause here and recognize that because we've done well to this point this year. But if we start letting our hair down too soon, this is going to become problematic pretty quickly. The other thing that I wanted to share with you all is that regulations about contact tracing and quarantining have changed. So at the outset of the school year, way back when, we talked about closing classes, schools, and the entire district based on the number of cases within the district and also in the surrounding community. Those rules, those guidelines no longer stand. What the CDC and DHHS are now recommending is that we contact trace back 48 hours, and anyone who is within 3 feet, not 6 feet, but 3 feet for more than 10 minutes is considered to be a close contact and should quarantine. So in theory, if we have a positive case of COVID-19 in the building, we should have no close contacts and no one should need to quarantine because in theory, we're keeping 6 feet of distance at all times. I'll share with you that the CDC and DHHS are now recommending that desks can be within 3 feet. We're not going to do that. So you have my word that we're going to keep desks 6 feet apart, even if it means taking more furniture out of rooms, and even if it means putting desks way in the back of the class near the sink or the door. We have the ability to keep kids 6 feet apart. We're going to do that. But when it comes to contact tracing, we're going to use that 3 foot rule, because that's what the experts are recommending, and that's what our marching orders are from the governor's office and from the Department of Health and Human Services. So if you have heard about positive cases in the building and heard about what those numbers of quarantining students or staff members are like, and they seem low to you, that's the reason, is that we are being pretty cautious, we are being pretty careful, we are keeping kids separate still, and we are wearing our masks. So hopefully when these cases come in, because they will come in, because they are here, it will not be spreading within the community, and we will not need to quarantine very many people. The reality is that in an elementary school with little people, yes, from time to time we do end up coming within those 6 feet. We do end up working with small groups. We do end up leaning in a little bit to hear what kids are saying when we're reading with them. It's inevitable. If we're going to do our jobs as educators, there's going to be a little bit of that. But we're trying to minimize that and make things as safe as possible while still running an effective educational program for our students. So I maintain that the Enfield Village School is a very safe place to be and to learn. I think we've had a great year, but I do think we're in for a little bit of a rocky road over the next couple of weeks. I do worry about coming back from April break and what that might look like now that there are no restrictions around travel outside of New England, and now that people are feeling a little more comfortable. So I would encourage you all to make good choices and to make choices that take into consideration the health and well-being of our entire community, and we will get through this together. On that note, I wish you all well. You know who cares for you? We do. And you know how much. Take care, EVS Owls. We'll check in again soon.